Hello mga Dockies, this is Doc Jean and welcome to Dental Life. In this video, I'm going to tackle something that is very sensitive and may have consequences on my part, but I believe that courage is not an absence of fear, but rather an assessment that something else is more important than fear. The topic for today may not directly affect some dentists, but this can be viewed that is something that we need to be involved in because this can be a precedent wherein our professional autonomy to practice our field as a dentist can be controlled rather than just be regulated. I really hope that we will be unified in questioning the recently released Professional Regulatory Board Dentistry Resolution number 13. Because there are some questions that needs to be raised and clarified because it directly affects our rights as dental practitioners in this country. If you agree with me and you would like to protect our rights, I hope in the description below after this video, you will click it and be part of the petition in order to raise the question about the contents of resolution number 13. For transparency's sake, I've been a practitioner for more than 30 years, a local and international speaker, and have seen a lot of things that I rather would not like to see in this lifetime. However, these are the facts that is happening in our country as well within our community. It is a fact that our country is around 115 to 120 rank in the most corrupt countries in the world. Number two, there are a lot of laws or regulation that can be used to control rather than really address the needs of its citizen or members. Number three, there is always a question of trust whether our leaders are really there to protect us or promote their own vested interests. Because with power comes with a very big responsibility of making sure that your intent in any act within your responsibilities must be based in the goodness of the majority. Now, I have to be fair on this resolution number 13, which again, I will attach in the description below, and you can read it for your reference and make your own decision on what is your position. I am just here to raise the questions and concerns as a dentist, as well as my company who offers an educational training for facial aesthetics in dentistry. And just to be very transparent, that is not the only reason why I am here. Because number one, as I have mentioned before, there are a lot of things that I don't like that is happening in our organization, in the leaders that handles our profession. However, unfortunately, like majority of a lot of dentists, we try to avoid being in conflict with those in power because they can easily use this to threaten your very profession and means of livelihood. That's why they can easily shut us up even if whatever we see is wrong. And this comes into the thought that evil flourishes when good people do nothing. And that is why I am tackling this issue, because there is really something wrong with the manner and execution of this resolution. Number one, in the first paragraph, they have defined what is their function in our dental practice. My question there is, none of the description is stated in Republic Act 9484 as their responsibility that includes the ability and the power to amend a law. Because Republic Act 9484, if any organization or individual would like to amend the law, then this has to be under the Act of Congress. I have consulted my legal counsel, and this is how we handle any laws in our land if we want to amend it. It is a fundamental principle of legal hierarchy that a regulation or rule cannot attain supremacy over an existing law unless and until Congress, as the legislative authority, takes deliberate action to modify or revoke such law in accordance with established legislative procedures. So on the first paragraph of the resolution, the role of the Board of Dentistry does not indicate that they have the right to amend an existing law without the enactment of Congress and be able to go to the proper legislative process. On the second paragraph, they define what is a dentist. Now, again, the interpretation of a law can only be done by the judiciary system, which means only a judge can define and interpret the meaning of a law. And nobody has the right to expand the meaning of the law just because it fits their purpose. Mga dockies, when I started to offer facial aesthetics in the field of dentistry, I've done my due diligence by creating a registered SEC company, going through the proper channels, and asking two different legal counsel to check the validity of dentists practicing facial aesthetics. And during those time, based precisely on this Republic Act 9484, as well as Dental Act 2007, the definition is performs any operation or part of an operation upon the human oral cavity, jaws, teeth, and surrounding tissues. On the third one, they have indicated that it was amended under the resolution number 14 and resolution number 3 in the Code of Ethics. Now, again, any interpretation of the law must be done by the judge. As far as I know, the way the legal works or process is done in our country. Now, this board ended up trying to set the exact meaning of Republic Act 9484 that defines what is a dentist. Now, mga dokis, in any given body, why is that organization or body created in the first place? Diba, to protect the very people you represent. Now, my question here is that if you will read the entirety of resolution number 13, who does the Board of Dentistry truly protect? Is it the entire dental community or just certain association and society wherein supposedly they consulted, as is stated here? And if you will read every association and organization that they consulted, one may interpolate or assess that this organization have their own conflicting interests and probably have their own vested interests in order to confine certain procedures that can only be done under their specialization and not specifically by others who may attain the skills to do this treatment in another way and may not be a member of their organization. Now, there is a saying, a road to hell is paved way by good intentions. I am assuming that the Board of Dentistry have a good intention why they release this resolution. I can understand that maybe their main concern is the safety of the patient. Honestly, mga dokis, I agree with that. As a person who've been a victim of medical malpractice 3 times, including being disabled for life due to malpractice of a medical physician, I would like our board and our PDA to make sure that our professionals are competent enough to do their treatment for the safety of our patient. After all, our first oath is first, do no harm. Having said that, mga dokis, that is the reason why instead of me keep on complaining about what I do not like in our organization, in our society, I ended up building D&D Center because instead of being negative, I became proactive and created a corporation in order to provide skills training to dental professionals, and the mentors are well qualified to do these trainings. In facial aesthetics, all of our students know that we followed the law last year. We confined the training within the lower one-third. Now, what is the contention of why facial aesthetics is excluded in the practice of dentistry, as is stated in this resolution? My question is, 1, is the definition of the practice of dentistry in the following countries that consider dentists allowed to do this practice, does it mean that their definition of dentistry or practice of dentistry different from ours? Are we better than United States, United Kingdom, Australia, Canada, Brazil, Spain, Germany, France, Italy, South Korea, Japan, UAE? Does it mean that our Board of Dentistry has the right definition of dental practice than the organization of dental professionals of this country? Second, the question based on the definition of 9484, there is never an indication there that it is confined via internal injection. Does it mean that our dental professionals are incompetent to the point we do not know anatomy? To the point that even if we train well in the right way, we cannot do this procedure that involves dental cases? For example, mga dokis, gummy tooth smile, that can be fixed in a non-surgical way through botulinum toxin. Now, why are you asking the opinion of surgical society when facial aesthetics is considered non-surgical? Is gummy tooth smile a medical scope? Is bruxism or clenching a medical specialty or a dental one? Mga dokis, I personally suffer from clenching to the point that the roots of my teeth are resorbing. Now, yes, there is a treatment that I can take by wearing an appliance or by taking a medicine that is not good to take more than 6 months because of its side effect. Are you telling us that we cannot do botulinum toxin to our patients who are suffering from the same thing that I am suffering, which is clearly a dental habit that needs to be resolved in the most minimally invasive procedure? And what is that? Bonta or botulinum toxin. Are you telling us that when we have patients with dental conditions, we have to tell them to go to a medical doctor in order to give them the treatment that is under clearly our jurisdiction as a dentist? Are you telling us that we have to hire or pay a medical practitioner to oversee us who studied for 6 years and for some studied more in order to hone our skills and knowledge in the practice of dentistry? Now, the next issue. Evil flourishes when good people do nothing. Mga dokis, if you will read the entire thing, there are some that I do agree, because we have to admit that sometimes we are also wrong. Precisely why I keep on telling dentists who are enrolling our full program that the program of DMD Center is different from the short ones. Because the practice of facial aesthetics requires indeed training after training. And you need to have the basic foundation coming from experienced, respectable medical or dental practitioners. The problem is, on some of the dentists, we prioritize price in investing in our education. And that is why the Board of Dentistry has the justification sometimes to be concerned on the safety of our patients. That is not only in facial aesthetics, but in orthodontics, implants, and all other specialization that requires special training. Now, my question here is this: why are you restricting the method of treatment wherein you know that science is an evolving thing? That in order for the dental professional to grow, and us Filipinos who are dentists to be within the global standard of qualification, we need to have the autonomy and freedom to study, train, and be able to use these available treatments to our patient within the scope of our practice, which is the lower 1/3. How come our leaders are not questioning ENT who are doing TMJ? How come that there are medical professionals who are practicing the field of dentistry during their own surgery without requesting consultation from dentists? Are you telling us that we are so incompetent that we do not know anatomy? Didn't we study the entire cadaver during our college days? Aren't we saying that the mouth is actually connected in the entire face and in our entire body? And yet, the resolution is restricting every dentist and telling us what we can and cannot do. Now, let's just say, mga dokis, that they are right. The question now is that if during surgery, there is a complication and the tooth migrated in a certain area, are you going to tell the surgeon to wait a few hours, especially in the traffic here in the Philippines, or to tell the patient to be rushed in the hospital because the dentist cannot perform that part because the tooth or the instrument that probably broke and migrated to a certain place cannot be touched by a surgeon who went into training, and that is the reason why he is practicing surgery? My thoughts is like this. Any law or any regulation, when used to control or restrict, instead of actually just regulating it, and the priority is for growth, then there is something wrong, mga dokis. If our community will allow this to happen, sa totoo lang, mga dokis, this will become a precedent. And if next time there will be other people who will sit in the board of dentistry and ended up deciding that only prosthodontists and not general practitioner can do crowns, veneers, bridges, RPT, dentures, then what are you going to do about it? And even if you complain by that time, if we allow this resolution to pass, it becomes a precedent act, and whoever is seated there and empowered by that time will have this as an example to continually control our community. Mga dokis, that is precisely the reason why I created Dental Life and why I created this DMD Center. Money was never my motivation. Of course, I need money. I like money. I will not deny that. I will be a hypocrite if I don't say that. But that money does not run my life. The only purpose of money for me is being able to have a choice. Precisely like this, I have a choice to defend the freedom and the right of the autonomy of individual dentists to be able to train well and practice the kind of treatment they believe can be applied in treating precisely the definition of where we can treat as dentists. Now, mga dokis, The reason we get abused all the time, and the reason why those in power are not scared to decide things that are against our rights is precisely because we allow them to do so. I am willing to fight with you, but only if you are going to fight with me. Because this cannot be solved by a single person or by a single organization. It has to be a unified front. And it is about time that all of us in this practice must be courageous enough to fight for our rights. We have to stop certain people who abuse their power in order to control the growth and improvement of dentistry in the Philippines. I have discussed that in my video, why the growth in our country is ever so slow. And the same thing that I tackle, why there are things that we cannot change, but we can certainly improve. Now, it is not our fault that we are born in this country. And unfortunately, the justice system here can probably be bought and ever so slow. But I truly believe that if you are fighting for what is right, then sooner or later, God will provide the proper answer. Mga dokis, I can literally retire. I cannot practice dentistry because of my back, precisely due to medical malpractice. So, I have nothing to lose. But I love our profession. And I care for us to become equal in global standard. And this will never happen if certain leaders we do have will end up controlling us and restricting us to grow because of their own vested interest, rather than supporting the very profession they represent. Mga dokis, I truly hope that we will not continue to be indifferent and apathetic just because it doesn't concern us. Remember, what comes around goes around. So let us support each other. For once, let's stand on what is right and support our profession in order that we can create, build, grow, and sustain our dental life. This is docjean, and I hope that this video will not be in vain. Bye.